Good afternoon, everyone. Thank you for having me here. I'll be talking about our research which studied the correlation between nasal mucosal temperature and nasal patency. I'd like to thank the Foundation for the funding of this study and no other conflicts of interest declared. Nasal airway obstruction is common, and one of the problems in rhinology is that some patients still complain of obstruction despite having a nicely open airway postoperatively. There's also a lack of correlation between patient perception and nasal patency and objective tests of airflow. So, recent evidence suggests that mucosal temperature may play a role in nasal patency with the discovery of TRPM8, which is a thermoreceptor in the nasal cavity which gets activated during nasal breathing, which sends sensation of a cooler nose into the brain. Several studies using physical measurements have also supported this hypothesis, which suggests that lower temperature inside the nose equals better nasal patency. Therefore, the aim of this study is to confirm these findings through computational fluid dynamics. And what is CFD? CFD is a branch of fluid mechanics used to analyze and solve problems involving fluid flow and around solid structures. And applications are widespread. It includes designing Formula 1 cars and space rockets. And in medicine, CFD models are based on CT or MRI imaging. We've recruited healthy adult participants with no sinonasal symptoms. Subjective nasal patency is quantified using VAS and NO scores, and objective nasal patency using direct and indirect measurements are also done. Prior to this, each participant is seated in a climate-controlled room set to 20 degrees for 15 minutes as they fill up the VAS and NO scores. With the direct temperature measurements, we have two operators, one on the nasendoscope and one on the temperature probe, to allow consistent placement of the probe, which is recorded in the vestibule, inferior turbinate, middle turbinate, and nasopharynx, and the temperature that we record is averaged out. The CT scan is then used for CFD modeling, and we use two programs. So in the picture on the left, we use a program called 3D Slicer to paint in the nasal cavity to create the nasal cavity models. And on the right, we use the program called GeoMagic to form meshes in models to allow CFD simulations to run. CFD simulations were done under standardized conditions to emulate nasal breathing on room air. And aside from temperature, we also measured heat flux, or the amount of heat loss during nasal breathing. So average heat flux is the average value of the cumulative heat flux from the vestibule to the nasopharynx, whereas the peak heat flux is the highest flux value in the nose at a certain point during respiration. We recruited 11 participants, 5 males and 6 females. And if you see the graph on the right, you can see that there is an increase in median temperature in both nasal cavities from the vestibule to nasopharynx on both direct and CFD-derived temperature measurements. This diagram that you see here demonstrates the temperature distribution between direct and CFD-derived mucosal temperatures. So the two graphs on the left show direct and CFD temperatures on all subsites, where blue is direct and red is CFD. The graph on the right shows the overall distribution between direct and CFD-derived temperatures. And while there are some differences, they largely follow the same upwards trend and correlate with each other. We also calculated the median values of average and peak heat flux, which is on the left. The figure on the right demonstrates that the heat flux average of all 11 models from all participants, where 0 represents the front of the nose and 1, which represents the back of the nasopharynx. Most of the heat flux, as you can see, the peak heat flux occurs in the area of the nasal valve between the 0 to 0.2 range. So what we did next was calculate temperature differences from each subsite, such as temperature change between vestibule to inferior turbinate and inferior turbinate to middle turbinate. And what I want to highlight is that we've noted a positive correlation between temperature change in nose and VAS scores using the correlation coefficient, which means that the higher the temperature rise between each side is, the worse the perceived nasal patency. And in particular, our strongest correlation is seen between the vestibule and the inferior turbinate, where the right side showed an R-score of 0.56. We also performed correlations between peak and average CFD-derived heat flux and nose and VAS scores, and these show weakly negative correlations, which suggest that the higher the heat flux or the heat loss, the lower your VAS and nose score will be, which adds more to the evidence that the cooler your nose is, the better your nasal patency is going to be. There are a few study limitations, which include small number of participants in a pilot study, the use of the general purpose temperature probe, and we did not account for mucosal engorgement during nasal cycling. And in conclusions, our study suggests that lower nasal mucosal temperature and higher heat flux correlates to better perception of nasal breathing. Good correlation is also seen between direct and CFD-derived temperature measurements. Future studies that can be done to implement CFD temperature measurements include doing the same study in patients' nasal obstruction pre- and post-operatively. We can also apply these clinically to virtual surgery simulations, where we can emulate surgery by resecting the inferior turbinate, for instance, and assess the temperature and heat flux profile, so we can plan for the optimal surgery, which is the hope that CFD may be a modality that can be used and plan and optimize the outcomes in sinonasal surgery. Thank you very much.